Thank you very much. It's an honor to present my dissertation work entitled Work-Life Balance Among Family Caregivers of Adults with Parkinson's Disease, a Mixed Methods Study. And I'd like to acknowledge my dissertation committee, Dr. Victoria Dixon, who's been my inspiring mentor for this project, and Dr. Witkowski-Stimfel and Dr. Fletcher, all three professors who are from NYU. I'd also like to acknowledge how grateful I am for funding for this project provided by the Pilot Project Research Training Program and also the Nursing Doctoral Training Program T42 grant. To begin, studying family caregivers is important because there are many people who act as caregivers in the United States. And according to caregiver statistics, over time, these caregivers' health has declined. In this study, I'm specifically interested in caregivers taking care of those with Parkinson's disease, which is a progressive brain disease projected to affect 1.2 million adults in the future. More are diagnosed younger, a pivotal time that has work and life demands. Here on the right, the green bars show that the cost of caregiving is increasing, as is direct medical cost, shown in the blue increasing bars. What we do not know is the association of caregiving roles and working. And so, the purpose of my study is to explore family caregiver perspectives on work-life balance. My quantitative, qualitative, and data integration aims are all listed here, which I will go into further in the study results. This is my conceptual framework that is guiding my study. It was adapted from the original work-life conflict model, and this conceptualizes how time, stress, or behavior in the working role may limit the ability to be present in the family role. This is a visual graph of my mixed methods design, whereby the quant or quantitative data and the qualitative data are collected at the same time on the same group of participants. Both quantitative and qualitative data of the same 40 participants will be included in the integrative analysis and the interpretation. My inclusion criteria for enrollment was that I was seeking out primary caregivers ages 18 to 75 who are not paid for their caregiving, but employed for other work, or at least employed within the last 3 years. On the right is my flyer. The flyer was shared electronically with various support group leaders of Parkinson's disease caregivers who would contact me by email if they were interested. Due to pandemic restrictions, the entire protocol was designed to be remote. So informed consent, screening, survey questionnaires, and recorded audio Zoom only interviews were done all remotely without anybody having to meet me in person. As is characteristics of caregivers in most samples in the literature, the demographics here from my results show a similar pattern in that most, as you can see in table 1, were female, married, spouses taking care of spouses, living in the same household. And then this particular demographic sample, according to table 2, which I summarized, had a larger percentage of more educated participants. As far as work goes, 28 were working, 50% full-time, while 12 out of 40 participants were retired, but they were working to some capacity within the last 3 years. As you can see from this slide, a wide range of employment roles enrolled in the study, which is what we had hoped for. The qualitative analysis was completed first. The overarching theme is listed here. On the slide, I present examples of quotes that illustrate the intersectionality of time, stress, and behavior. Some participants shared descriptions of undergoing role transformation between the workplace and family structure. Others, caregiving was challenging, but their work-related goals were stable and satisfying. And others did experience work-life conflict, where they stated that participation in work, although it was satisfying, made it more difficult to be physically present at home as a caregiver. A sub-theme from the analysis included barriers to work-life balance. These barriers are multi-contextual. They included physical stress. Some jobs were physically demanding, and that affected the ability to be a good caregiver at home. There was emotional stress, where sometimes a person might have refused treatment, and that added stress on the caregiver. There was also financial stress, where family members may not be able to afford professionally paid caregivers, and found that it was just financially more practical for them to retire or to cut down their own work hours and simply do the caregiving themselves. And several indicated it was nearly impossible to find any home help during the pandemic, which influenced their choice to stop working professionally. It's interesting, since we heard a little bit about that earlier. A sub-theme that we also looked at was facilitators. And examples are shown on the slide. Frequently, the intrinsic facilitator or personal facilitator that came up was that the person was in good health themselves. Setting boundaries was important. And then there were work-related facilitators, including job proximity or having job flexibility, where a person could simply leave whenever they needed to. We asked how people take care of themselves, and wellness was the third sub-theme that came out of this analysis. Have had access to workplace wellness programs like yoga, gym membership, or even mental health resources, although they didn't necessarily use these options. And when we think about worker wellness and what that might mean, participants indicated that for them, work was seen as a form of self-care. So when I asked, what do you do to take care of yourself? People actually said, I go to work. And just giving you a sneak peek for the sake of time of my quantitative results, which I'm just beginning to analyze now, you can see here that subjects rated their ability toward work-life balance only as somewhat successful. And we see there's a lot of tension balancing work and life. The integrative results are still in progress. So I'm planning to triangulate my qualitative and quantitative results, hopefully to eventually improve well-being, health promotion, and quality of life for those with dual roles. These are my publications, current, in preparation, and planned. And I thank you for your time, and I welcome any questions.